Let's now take up diagnosis through the ears, physical changes. Another key aspect of diagnostic ear reading is to observe the changes in the physical shape of the ears, whether there are nodules or protrusions, and whether there is a foreign body in the ear, all of which are criteria for diagnosing an ailment. A normal, healthy ear should have stiff ear bones, and the helix should appear smooth and level, while the auricle is meaty and moist without any nodules. If the ears have bumps or cord-like bumps, spots of depression, and a dull appearance, it usually indicates chronic organic diseases such as cirrhosis of the liver and tumors. If there is pus or bleeding in the ear, this is a manifestation of a hyperactive liver and gallbladder heat flaring up, and more attention is required. This is swelling and aching auricle. A red swelling auricle indicates hyperactivity of wind heat and liver yang, which often result in symptoms such as coughing, stuffy nose, and headaches. Ear with nodules. If nodules or cord-like bumps and depressed spots appear in some part of the ear, it may be a sign of cirrhosis of the liver and tumors. Ear bleeding. A sudden burst of blood that is substantial in volume, accompanied by ear pain, means the liver fire is blazing upward adversely. When the bleeding is gradual and not substantial in volume, it suggests hyperactivity of fire due to yin deficiency. Fleshy growth inside the ear. A tiny fleshy growth in the external acoustic meatus that is cherry-shaped with a big head but small stem, also known as hemorrhoid of the ear, is mostly caused by heat toxin in the liver and gallbladder. Pus in the ear. When there is pus in the ear, it is usually the result of wind heat disturbing upward, damp heat of the liver and gallbladder, or deficiency of the kidney yin, leading to the flaring up of the deficient fire. Tips for caring for your ears. Pour the earlobe downward. Frequently massaging the ear helps dredge the meridians and channels to enhance the flow of qi and blood, strengthening the kidneys and lower back. You can do this by pulling upward on the apex of the auricle and pulling downward on the earlobe, then pressing the tragus. Press need the Tai Chung point, an acupoint that soothes the liver, regulates blood, and clears the meridians. The Tai Chung point is effective for preventing ear bleeding. Frequent massaging of this point helps relieve dizziness, insomnia, and high blood pressure. Thank you for your attention.
Let's proceed to interviewing area and nature of pain. And let's start with area of pain. In localized pain, it is usually due to phlegm, stasis, or obstruction by cold and or dampness. Moving pain is usually due to qi stagnation unless it is due to wind in this. Now let's go to nature of pain. In general, a pain or ache that is mild in nature indicates a deficiency, whereas a sharp, severe pain is due to a fullness. It should be noted that a mild pain is usually dull and that a dull pain also may be intense. For example, a headache from blood deficiency will be mild in its intensity and dull in nature. However, an occipital headache from invasion of external cold may be dull in its nature but very intense. Thus, when a patient complains of a dull headache, we should clarify whether this is mild, suggesting deficiency, or intense, suggesting fullness. The pain from a fullness is due to the obstruction of the channels by a pathogenic factor, which may be exterior pathogenic factor, interior cold or heat, stagnation of qi, stasis of blood, dampness, phlegm, or retention of food. All these pathogenic factors obstruct the circulation of qi and/or blood and therefore cause pain. There is a well-known saying in Chinese medicine that states, obstruction causes pain. If there is no obstruction, there is no pain. Bo tong che tong, tong che bu tong. Phlegm does not generally cause pain, but may do so in few cases. A deficiency may cause pain through malnourishment of the channels. In this case, the pain will be mild, more like an ache, and will be clearly alleviated by rest. However, also in deficiency pain, there is some element of stagnation as the deficient qi fails to move properly. Thank you for your attention.
So let us go to syndrome, pattern, and disease. The topic is TCM and biomedicine. The word syndrome comes from the Greek roots syn, meaning together, and dramin, meaning to run. That is, to run together or to go together. Therefore, the word is defined as a set of signs and symptoms that tend to occur together and which reflect the presence of a particular disease. A syndrome is the association of several recognizable clinical features, signs and symptoms, or other phenomena that often occur together. The presence of one or more of these features alert the physician to look for occurrences of the rest in order to confirm or rule out the syndrome in question. The description of a syndrome includes a number of essential characteristics that, when concurrent, confirm the diagnosis of a condition. Frequently, said characteristics are divided into A, typical major symptoms and signs that must be present to confirm the diagnosis, and B, minor findings, some or all of which may be absent. Some technical descriptions will specify the minimum number of major and minor findings required to confirm the diagnosis. TCM pattern. A pattern of disharmony in TCM is not a fixed entity, rather than a collection of signs and symptoms that are specifically linked to a condition or disease. The pattern represents a series of functional relationships that become apparent after a process of analysis and interpretation of all findings in a given situation. The TCM pattern is thus a snapshot of a general state of well-being of an individual at a given time. It can be thought of as a dynamic schematic of the individual's constitutional tendencies, physiological processes, and current influences to their state of health, including lifestyle, emotional disposition, diet, and the prevailing weather patterns of their locale, etc. The corollary of this is that a pattern of disharmony may not present as clearly recognizable disease. Rather, it portrays the tendencies that may lead to a pathological manifestation, thus allowing the practitioner to construct a holistic preventative treatment before a disease process is established. Pattern discrimination. For pattern discrimination is the process of analyzing the data obtained through the four methods to arrive at a diagnosis concerning the patient's pattern of disharmony, according to TCM theory. Patterns are discerned from the presence and or absence of given signs and symptoms in combination. This is important because almost any sign or symptom in Chinese medicine can point to more than one pattern of disharmony, depending on what other signs and symptoms occur with it. The sum total of what is and is not present paints a picture of the current stage of the disease process, revealing its etiology, location, and nature. The pathophysiology of the condition is deducted from the reactions, like signs and symptoms, manifested by the patient, which may vary as the condition progresses. This model constitutes the foundation for establishing a therapeutic strategy that addresses the specific current condition of the patient, while also considering their basic constitution, inheritance, environment, and current life circumstance. In sum, the TCM pattern of disharmony reflects the essential nature of the disease process at the moment when it is observed. A TCM pattern of disharmony reflects the essence of the disease at a given point in time. Disease versus pattern. Disease is often defined as a condition opposite to health, that is, the absence or lack of health. More specifically, the term broadly refers to any condition that impairs normal function. Disease is a name given to an abnormal medical condition that affects the body and is associated with specific symptoms and signs. In many cases, the term disease is used interchangeably with disorder and illness. The term disorder in medicine refers to a functional abnormality or disturbance and is often considered a more value-neutral and less stigmatizing term than disease and syndrome. In biomedical terms, disease frequently refers to a certain condition where the nature and regularity are recognized from its causes. Conversely, a TCM pattern focuses on the organism's reactions, not its cause or etiology, although these can usually be deduced from the overall picture of the patient's disharmony. Thank you for your attention.
We proceed to differential diagnosis, both for Western medicine and Chinese medicine, for cerebrovascular accident, stroke. For the Western differentiation, CVA means the sudden death of some brain cells due to lack of oxygen when blood flow to the brain is impaired by blockage or rupture of an artery to the brain. CVA is also referred to as stroke. The term wind stroke in Chinese medicine corresponds to 4 possible Western conditions. They all usually present a sudden onset of one-sided weakness of limbs with other features depending on cause and site of damage. 1, cerebral hemorrhage, which constitutes about 10% of strokes. There is weakness or paralysis, numbness, tingling, visual changes, slurred speech, difficulty swallowing, drooling, loss of memory, vertigo, poor coordination or balance, personality or mood changes, eyelid drooping, drowsiness, loss of consciousness. Second, cerebral thrombosis, which comprises about 50%. This is characterized by weakness or paralysis, numbness, tingling, visual changes, also slurred speech, difficulty swallowing, drooling, loss of memory, vertigo, poor coordination or balance, personality, mood changes, eyelid drooping, drowsiness, and loss of consciousness. The third is cerebral embolism, which is about 30%. There is weakness or paralysis, numbness, tingling, visual changes, slurred speech, difficulty swallowing, drooling, loss of memory, vertigo, poor coordination or balance. And finally, we have cerebral spasm. This is spasm of cerebral vessel that occurs on temporary contraction. This is the least severe of the 4 and usually followed by complete recovery. Now let's go to Chinese differentiation of CVA. Diagnostic questioning according to classification of wind stroke. We have 3 classifications. We have channel stroke, which is actually mild stroke from external wind affecting the channels only, causing no loss of consciousness, facial paralysis, dysphagia, hemiplegia. The second is organ or visceral stroke. This is severe stroke causing damage to internal organs, loss of consciousness, hemiplegia, facial paralysis, dysphagia, leading to disability or death. Either dissertion patterns with open mouth, limp hands, open eyes, enuresis, snoring voice, or stagnation patterns with clenched jaw or hands, subdivided as yin or yang. And then we have the sequelae, which is actually the result of the channel or organ stroke, hemiplegia, facial paralysis, loss of vision, and dysphagia. We can also do the diagnostic questioning according to mechanisms of internal wind. Now we have yin deficiency. There is hyperactive liver yang leading to wind. Attack can be sudden or catastrophic. Second mechanism would be blood deficiency. There is failure of blood to anchor the qi, so there will be tics, tremors, spasms. Third is heat. The internal heat congeals body fluids, causing phlegm, and the heat becomes wind, carries phlegm towards the head. Then we have diagnostic questioning according to the 4 main etiological factors: emotional stress, excessive sexual activity, irregular diet, and physical overwork or inadequate rest. Now we have the Zhang-Fu patterns, the sequelae stage of organ stroke. Hemiplegia, the patterns are Qi deficiency with blood stasis, hyperactive liver yang with blood stasis. So select channel points for limb. For dysphagia, we have wind phlegm or kidney and liver yin yang deficiency. For facial paralysis, we do subcutaneous needling, stomach 6 to stomach 4 and stomach 2 to stomach 4, LI4 and lung 7. Thank you for your attention.
Fu viscera and irregular organs. The gallbladder. There are 6 Fu viscera: the gallbladder, the stomach, the small intestine, the large intestine, the urinary bladder, and the sanjiao. Their main physiological functions are to receive and decompose food and drink, and to pass and discharge waste. Their main functional characteristics are to digest and transform matter, but not to store it, and to function well when unobstructed. When Fu organs are disordered, the main method to restore their functions is by restoring their patency. The gallbladder. The gallbladder is a sac-shaped organ that is attached to the underside of the liver. It has 2 principal physiological functions. First is storing and excreting bile and aiding digestion. The liver produces and secretes bile. The bile then flows into the gallbladder where it is stored. Bile has a yellow-green color and is bitter in taste. It is important in promoting digestion. For this reason, bile is also called the essential juice, and the gallbladder, the house of the essential juice. The storage and excretion of bile are regulated by the liver function of conducting and facilitating. If this liver function is normal, the gallbladder excretes bile properly. The bile then flows into the intestinal tract, where it helps the spleen and stomach to carry out normal digestion. Diseases in the liver will affect the production and excretion of bile and impair digestion. Such symptoms as epigastric distension and pain, anorexia, aversion to greasy foods, abdominal distension, and mucoid diarrhea may appear. Upward flow of bile can lead to a bitter taste in the mouth, nausea, and vomiting. If bile overflows into the skin, there may be jaundice, with yellowing of the sclera and dark yellow urine. If dampness and heat accumulate in the liver and gallbladder and cause blockage, the liver loses its function of conducting and facilitating, and the gallbladder its ability to excrete bile. This may lead to the formation of bile stones. In this illustration, we see the gallbladder. The liver, where the gallbladder is found underneath, stores the bile. It excretes bile and aids digestion. When there is failure in the gallbladder of conducting and dispersing function of liver and gallbladder, there will be disharmony between the liver and gallbladder that affects courage and spirit of initiative. There will also be bitter taste, poor appetite, there may be nausea, there may be jaundice, and distending pain in the right subcostal region, and there may also be loose stools. Second, the gallbladder has the ability to decide. It is courage. The plain question states, the gallbladder is the upright official in charge of decision-making. This explains the relationship between the gallbladder and the person's ability to decide. Courage is also closely linked to the gallbladder. Deficiency of gallbladder qi may appear as fearfulness, insomnia, and dream-disturbed sleep. In this function, the gallbladder is closely linked to the liver. These 2 organs cooperate to regulate the emotions. The normal functioning of all mental activities, such as careful thinking, judgment, determination, and decision-making, requires cooperation between the liver and the gallbladder. Thus, in clinical practice, treatment of the liver and the gallbladder is the approach to many disorders involving the emotions. Thank you for listening.
As an imbalance, Doctor. Let's now proceed to diagnosis according to Zhang-Fu organ patterns, small intestine imbalance. The main function of the small intestine is to receive the untransformed dross from the stomach and separate the pure aspects that are still present from the impure waste. The pure fluids and qi that are extracted in the small intestine are transmitted upwards via the sangel, and the impure fluids and solids are sent to the urinary bladder and the large intestine respectively. Although these processes take place in the small intestine, they do so under the influence and control of the spleen and kidney yang. This means that most signs of imbalance in the small intestine are viewed as being spleen and kidney imbalances and treated accordingly. For example, in the treatment of diarrhea, spleen and stomach points will typically be used, not the small intestine points. When the small intestine is treated in this situation, it is usually through the use of its lower Hussey point, stomach 39. Small intestine imbalance patterns can arise when the small intestine is directly invaded from the exterior. This can occur through either the skin of the abdomen or the mouth and the stomach. Cold can invade through the skin of the abdomen when this area has been exposed to the climate, for example, when a person has worn too little or worn wet clothes. Damp heat, damp cold, or exogenous cold can invade the small intestine via the mouth and stomach when food that is contaminated or has gone off has been ingested, or when food that is energetically very cold or hot produces dampness or has a very cold temperature has been ingested. The long-term consumption of food and beverages that are energetically or physiologically cold will weaken the spleen yang and kidney yang. Damp heat, damp cold, and yang deficiency can all disrupt the speen's ability to transform and transport. This can manifest with changes in the stool and or pain in the abdomen. The consumption of energetically hot food as well as emotional imbalances can create stomach fire transmitted to the small intestine, creating heat. Parasitic worms are defined as etiological factors that are neither exterior nor interior. A person can have been infected through contact with contaminated food or dirt. Worms will enter the body through the mouth. The worms will block the movement of both qi and solids in the small intestine. By inhibiting the separation of the pure and the impure, worms will lead to malnutrition. Qi stagnation in the small intestine can arise when qi stagnates in the middle and lower jiao. Qi stagnation in the small intestine could affect the stool and cause intestinal pain. There are several factors that can lead to qi stagnation here. Liver qi stagnation can arise due to emotional frustrations, stress, repressed anger, and irritation. The stagnant liver qi can accumulate and block the movement of qi through the intestines. Worry, speculation, and thinking too much will bind and thereby stagnate spleen and stomach qi, so their qi mechanism grinds to a halt, with the result that qi movement through the intestines is impaired. Qi stagnation in the small intestine can also be a consequence of too little exercise, poor posture, and a general lack of physical movement. If a person spends too much time sitting still, especially if the posture is poor or they sit with a twisted midriff, will physically prevent the movement of qi through the intestines. This is a particular problem when a person eats whilst they are working on the computer. Excess heat can drain down to the small intestine from its partner organ, the heart. This means that all of the etiological factors that can lead to heart fire can be relevant here. Heat will disrupt the small intestine's function in relation to fluid physiology. The heat can thereby be transmitted to the urinary bladder, resulting in symptoms such as painful or burning urination, dark urine, and possibly blood in the urine. In some cases, deafness can result from pathogenic qi, for example, fire disrupting the flow of qi in the small intestine channel. General symptoms and signs of a small intestine imbalance are the following: abdominal pain, abdominal bloating, diarrhea, constipation, and berberigmi. Thank you for your attention.
Let us go to etiology in Chinese medicine. The topic is passions as causes of illness. The internal causes of illness are factors that directly disrupt qi and blood of the Zangfu viscera. This group comprises the 7 passions, inappropriate diet, and imbalance between work and rest. So let's look at the number 1, passions as causes of illness. The 7 passions are joy, rage, grief, brooding, anxiety, fear, and fright. These are extremes of the emotions that are the mind's responses to the environment. In normal circumstances, emotions do not cause disease. It is only when they become passions because of sudden appearance or extreme intensity or prolonged duration that they exceed the body's normal range of mental activities. When this happens, qi is disturbed and the balance between yin and yang and between qi and blood of the Zangfu viscera is lost, and illness may ensue. Let's look at relationship between passions and qi, blood of Zangfu viscera. In humans, the emotions are intimately related to the Zangfu viscera, and the functions of the viscera require the warming and activating actions of qi and nourishment from blood. The plain question states, the human has 5 Zang viscera, which engender 5 kinds of essential qi and produce the passions of joy, rage, brooding, grief, and fright. From this quote, it is clear that the emotional activities are dependent upon the visceral organs, essential qi. The plain questions also states that the heart's passion is joy, the liver's is rage, the spleen's is brooding, the lungs is grief, and the kidneys is fear. These 5 are sometimes collectively known as the 5 passions. The different passions have different effects on the different Zang organs. Conversely, the changes in the qi and blood of the Zangfu organs also influence the passions. Thus, the plain question states, superabundance of blood generates rage, whereas insufficiency of blood generates fear. The spirit pivot states that deficiency of liver qi generates fear, whereas excess of liver qi generates rage. Deficiency of heart qi generates grief, and whereas excess of heart qi generates sustained laughter. Let's look at number 2, which is the characteristics of passions. Direct injury of Zangfu viscera. The plain question states, rage impairs the liver, or excessive joy impairs the heart. Brooding impairs the spleen, and grief impairs the lung, and excessive fear impairs the kidney. However, in clinical practice, the responses can be more variable, since the human body is an organic whole. For example, bottled up rage can impair the liver, so that liver qi moves abnormally. It often also impairs the spleen and the stomach, leading to disharmony between liver and spleen or between liver and stomach. At the same time, the visceral organs, qi and blood provide the material basis for emotional activities. The heart governs blood and houses the spirit. The liver stores blood and governs conduction and facilitation. And the spleen governs transportation and transformation and is the source of qi and blood. Therefore, illnesses caused by emotional factors usually relate to disharmony between the qi and blood of the heart, the liver, and the spleen. For example, excessive joy, fright, and brooding all can impair the heart and induce unrest of the heart and spirit. This in turn can lead to such symptoms as palpitation of the heart, insomnia, forgetfulness, and even derangement of the mind. So here we can see the passions as causes of illness, where rage impairs the liver, excessive joy impairs the heart, brooding impairs the spleen, excessive grief impairs the lung, excessive fear impairs the kidney, and also anxiety and fright. All of these things, for when there are emotional changes for a long period of time, it can cause the dysfunction of the mind. And when there's dysfunction of the mind, it can also cause dysfunction of the endocrine and the sympathetic nervous system. And when all of those have dysfunctions, can lead to hypertension, cerebrovascular disease, coronary disease, gastrointestinal disorders, cancer, and neurogenic vomiting. Thank you so much for your attention.
We continue discussing the emotions, and we go to part 2 of sadness and grief. We have here a case history of a 40-year-old woman who was under a great deal of stress due to her divorce, which caused her great sadness. She often felt weepy, she felt aimless, and questioned her role in her relationships with men. She was at a turning point in her life and did not know what direction to take. She slept badly and her pulse was choppy. This is a clear example of sadness affecting the liver and therefore the ethereal soul. She was treated and improved tremendously with the yin linking vessel or yin wei mai points, pericardium 6 on the right and spleen 4 on the left, and bladder 23, bladder 52, and bladder 47. Dr. John Shen considers that grief that is unexpressed and born without tears affects the kidneys. According to him, when grief is held in without weeping, the fluids cannot come out in the form of tears, and they upset the fluid metabolism within the kidneys. This would happen only in situations when grief had been felt for many years. Sadness and grief are very common and important causes of disease in Western patients, much more than anger. Anger as an emotional cause of disease is overemphasized in Chinese books. What causes sadness and grief in Western patients? Apart from the obvious causes such as bereavement, very many Western patients of all ages suffer from sadness and grief deriving from the breakup of relationships or marriages. In other words, sadness and grief are primarily about loss, whether it be the loss of a dear one to death or the loss of a partner through separation. It is very important to remember that qi stagnation affects not only the liver, but especially in emotional problems, also the heart and lungs. Sadness, grief, and worry are common causes of qi stagnation affecting the lungs and heart. For example, in women, lung qi stagnation affects the chest and breasts, and in the long run, it can give rise to breast lumps, which can be benign or malignant. In Western women, this is a more common cause of breast lumps than liver qi stagnation. Dr. Xia Xiaonong thinks that breast lumps and breast cancer are due to sadness and grief deriving from widowhood, breaking of relationships, divorce, death of one's children, and bereavement at a young age from the death of one's spouse. These events, especially if they occur suddenly, upset the mind and lead to qi stagnation and qi depletion. It is interesting to note that all the events mentioned by Dr. Xia involve separation and loss. To summarize, sadness and grief affect the lungs and heart. Sadness and grief deplete qi. Sadness often causes a pulse without wave. That is, the pulse lacks a flowing movement from rear to front position, and it is instead felt as if each individual position were separate from the others. In the case of sadness, the pulse lacks a wave in the front and middle positions. Sadness and grief deplete qi, but after some time, they also lead to stagnation of qi. In some cases, sadness injures the liver. According to Dr. John Shen, grief that is unexpressed and born without tears affects the kidneys. Sadness and grief often derive from the breakup of relationships or marriage. Thank you for your attention.